Hi everyone. I'm going to make a brief COVID-19 update. So this is video 3. If you haven't seen 1 and 2, go back and watch. Lots of info in those as well. So this is kind of a public service announcement from my healthcare colleagues to you guys. And this is what I think you need to know right now, apart from everything else that's in the news and the media. And I'm sure you are all overwhelmed by all of this, but I hope you are surviving this lockdown and supporting each other in this time. So first of all, I want to emphasize the fact that social distancing and all of the measures and the lockdown situation that we are in right now has a delayed response effect from an epidemiological point of view. What we are doing today, we will see in the case numbers 2 to 3 weeks from now. So the numbers that we are seeing today are a reflection of what we were doing a couple of weeks ago, at which point we were not in a lockdown and we weren't being as strict and precautionary at that time. So yes, we will still see the numbers rise. It will get worse before it gets better. Another thing you need to keep in mind is there is a backlog of test results. So there will be a spike once we catch up. So what do you do if you have minor cough, cold symptoms? First of all, isolate. Apart from your family, and do not go out, and have your own bedroom and washroom if you can, your own utensils. Separate out everything. 2, call your family doctor so that you can get some advice via phone. If you don't have a family doctor or you can't reach them, call Telehealth Ontario. The number is 1-866-797-0000. Or if you can't reach them, then call your local public health department. But whatever you do, please do not go into a walk-in clinic, urgent care center, or the emergency department. Let's try and conserve resources and keep our emergency departments for actual medical emergencies, people who need the care right away. If we can handle it via phone, we should handle it via phone. There's 2 reasons for this. 1, if you are not that sick and you go into a hospital, likely you will come out more sick and you will catch whatever's in the air, whatever's going around. So protect yourself. 2, we have a dwindling supply of personal protective equipment. And when somebody goes in, even with minor symptoms, a doctor has to go in and assess them. They have to glove, mask up, and go in and see them, because we don't know that it's a minor cold before we actually see you. So all of those things that we had to put on to protect ourselves and protect you after we see you gets trashed. Most of our gloves, gowns, masks, shields are sort of designed to be one-time use things, and our supplies are very quickly dwindling. So if you guys actually have a stash of masks or gloves, please donate them to your local hospital. They are in dire need. Another thing I want to point out is if you do have those cough, cold symptoms, avoid taking non-steroidal anti-inflammatories like Advil, ibuprofen, Aleve, naproxen, because we have learned that those types of medications can lead to, if you have COVID-19, a more serious case of the disease. Another interesting fact is that people with coronavirus seem to lose their sense of smell and taste, just something to be aware of. If you have been tested for COVID-19, family doctors are now starting to receive those results. So instead of trying to chase it down with public health, you might want to check in with your own family doctor. If you gave your family doctor's information at the time of testing, hopefully we can help give you the results. Some studies are showing that the antibodies that are produced when you fight the disease and recover aren't necessarily providing long-term immunity, and that people can actually maybe even get it a second time with a different strain of the bug. So please just continue to be very, very careful with your hand hygiene and precautionary measures. In the US, everybody is getting it. It doesn't matter if you are young, old, healthy, sick. It doesn't seem to make a difference. And I think there's a few things we need to sort of pick out about this. One is that lots of young people are ending up in the ICU really, really sick. Why this might be, lots of reasons, but things to consider. One, the demographics of the inherent population that we're talking about. There are a lot more elderly people in Italy, and there are a lot more young people in New York City. Two, I think smoking, vaping, drug use, obesity, underlying diseases like asthma, COPD are playing a role as well. If you are a smoker, this is the time to quit. Please, 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 please reach out to your family doctor or a smoking cessation helpline and get the help and advice and guidance that you need to quit. Also, if you're an asthma or COPD patient, contact your own family doctor before you take oral steroids because they can immunosuppress you. Please don't hoard the medications that are under investigation as potential COVID-19 treatments. First of all, we don't have great evidence to say that they're really that effective. Second of all, these are medications that are used by people with things like lupus, and we don't want to have the toilet paper situation happen with these medications. A lot of medications right now in Ontario are on back order, so please, be responsible, get what you need, and we really don't need to hoard medications at this time. Second of all, please, please, please do not lie or withhold information from your healthcare provider about your travel history or potential exposure. We're trying to help you, and we will not turn you away, and we will not refuse to treat you even if you are at risk of having COVID-19. But it's important for us to be able to wear the protective equipment, protect ourselves, and protect you, and protect society. So we need to have this information. Also, can we not stigmatize people that are getting this disease? They didn't necessarily do anything wrong. We're all susceptible. Any one of us can get it. We all need to sort of, be cognizant of the fact that we can't put blame on someone who got it. Another last thing I'm going to say, this nasty virus is not going away anytime soon, unfortunately. We need a vaccine, we need proper medications. All of that is, under investigation. All of that is sort of being worked out. Another thing to look forward to on a positive note, I hope we will soon have point of care testing and be able to do COVID-19 testing really quickly and get the results right away instead of having that 3 to 5 day lag. So please, let's just stay together. Let's work together. I mean, not stay together. We certainly should not be staying together. We need to work together and do our part and stay safe and stay home and continue to practice all of those measures that I have talked about before. So everyone, please ask me your questions, share this video, spread awareness, and do your part.